All right, good morning, everyone. Welcome back. I hope you had a good evening. My cold is 100% not better, but we're powering through here. I want to introduce to you our next speaker, Dr. Juliette Sweet, who I met not more than a year ago, I believe. And Juliette works with Rebel Herbs, and this talk today is sponsored by Rebel Herbs, Ayurvedic company, who is a sponsor of these seminars as well as of the Naturopathic Education Research Consortium. So they've been a very generous sponsor of naturopathic residencies. Dr. Sweet holds a doctorate degree in naturopathic medicine and a master's degree in Ayurvedic sciences from Bastyr. They have an Ayurvedic program. Do they still have that program there? It ended. That's
anymore.
too bad.
I know.
You got out alive. She is also the owner of Spiravita Natural Health in New Mexico. Her practice focuses on sustainable healthcare, where she implements naturopathic and Ayurvedic philosophies for educational purposes, prevention purposes, and treatments. She is the director of clinical education for Rebel Herbs. She's also president of the New Mexico Association of Naturopathic Physicians and was actively involved in attaining licensure for naturopathic doctors in New Mexico in 2019. Thank you very much for doing all of that. So please welcome Dr. Sweet and her talk on pain and pediatric ADHD with Ayurvedic botanicals.
Thank you. Thank you. I'm really excited to be here today and be with all of you. And working through the master's degree in Ayurvedic medicine towards the last part of my doctorate degree, it really helped me to be able to continue on with the program, and it's very close to my heart. And so I'm excited to bring Ayurvedic medicine into the naturopathic realm and sort of bridge those two, because our philosophies, as you will see, are very similar. And so we will get started. So, excuse me, I'm going to do my best to stick to my timeline. I'm kind of doing two presentations, so pain, and then we'll have a little transition period, and then we'll talk about pediatric ADHD and different botanicals and different things that can help. And I definitely hope to have some time to answer any questions and maybe even discuss case studies that you all have dealt with. This is a great time for us to share together. So a little bit on the Ayurvedic philosophy. Ayurveda translates to the science of life. Excuse me. And so the Ayur is life and Veda is knowledge. So maybe you've heard of the ancient Vedic texts. And those are books that talk about all the different things you would ever need to know in life and how to maintain balance. And so Ayurveda originated in India over 5,000 years ago. I personally like to think of it as this inseparable connection we have with nature. So all of the elements that are in nature we have inside of us. And it's really sort of the unique individual and their makeup that allows us to create individualized treatment plans and help maintain this balance, which I question if there ever is really balance in life, but we do our best. So just a little bit about the doshas. How many of you are familiar with Ayurvedic philosophy a little bit? A lot of, okay, great. So the importance here is just that it helps us to classify the different elements in body types. We have every dosha in us, we have every element in us, and all of the elements have qualities. And so that's really the important piece when we're thinking about utilizing herbs and different therapies is treating the qualities that maybe need to be more balanced or counterbalanced. Samprapti is the disease process, and it's always an imbalance in the qualities or elements or doshas. And then you might have heard the terms prakriti versus vikriti. So prakriti is your constitutional makeup, what you kind of came into the world with, and that has to do with so many factors. What time of year your parents conceived you, what doshas they have inside of them, where you live, according to Ayurvedic philosophy. And so why it's important is we're trying to help a patient get back to their constitutional makeup and their more, the balance that they kind of came in with. And then Vikriti is the current state of imbalance. So just as I mentioned, you have every element, every dosha, and every quality in you. This is just an example of where those elements are seen in the body. So anytime there's movement in the body, nerve transmission, the release of fluids, menses, anytime there's movement, breath, the heartbeat, air is involved because it's wind, it's movement in the body. And then we have our water, which is our saliva and our blood and our lymph. Body cavities, so ether we consider more space. And so those are the body cavities. Earth is stable, it's solid, it's sustenance, so it's your bones, your tissues. And then fire is our temperature, metabolism, and any sort of biochemical reaction that creates heat in the body. And then our naturopathic principles, which is anybody here not a naturopathic doctor? Okay, so you're probably familiar with these. We've been discussing them probably throughout lectures. Can someone tell me if we added science to our naturopathic principles recently? Did you just? Research, okay, great. I was trying to find out if that was I knew it was maybe coming down the pipeline. So anyways, we know our naturopathic principles, and why I bring this up is that both philosophies agree that you need to determine the underlying cause of symptoms. So wherever that imbalance is, we're gonna treat the individual, treat the whole person, and then we always treat the gut. So I tried to find the best representation of a hipster on my slide for you guys. I love the Pacific Northwest, I miss it. So anyways, we know that there's multifactorial aspects of pain. So there is physical pain, and that's acute pain due to injury, surgery, chronic pain, anything that persists. So after the tissue has healed, anything that's continuing on or anything that's longer than 3 months. Of course, there's a little leeway if someone's had a really deep surgery or traumatic event, it could take longer and not be considered chronic. Emotional pain, I have not seen it affect pain. I've not seen it affect it on emotional level really with any of my patients. I'm sure some people can completely detach from pain, but usually there's an emotional response. And then the mental perception of pain. So I'm always interested in chronic pain and why some patients can keep living their lives and others have a really hard time where they give up. And you know, as the pain pathways become more ingrained, people identify with pain, and it absolutely can become someone's entire life. So pain is known as shula, which is an imbalance of the doshas, as I mentioned. And thinking of those doshas, thinking of those elements and qualities, what do we see in pain? So vata, which is our air and ether, I really didn't have any issues with my throat until I came up here. That's when pain is sharp, when it's shooting pain, if there's destruction of tissue. But really it's always involved in pain. Why? Because vata is the ruler of our nervous system, and anytime there's transmission happening, movement in the body, it's going to be involved. Pitta we think of more as inflammation, so anything that's hot, pulsating, especially with qualities that are sharp or penetrating. And then kapha, one of my mentors used to always say, where there's stagnation, there is pain, and that's what's true when there is a kapha imbalance. It can be swelling, it can be even a tumor, a benign tumor, and anytime there is sort of that deep, dull, achy pain, we think more about kapha and stagnation. So the other thing I want to talk about is the vitality of the person. So we know that as the vis in naturopathic medicine, and Ayurveda would call that ojas, which is your sort of lustrousness, your immune function, your just vitality overall. And then like I said, treating the gut, so digestive fire. You also want to consider toxic buildup in the body, and we call that ama. So just an overview really quickly, how we compare naturopathic and Ayurvedic philosophies to pain. So treating the whole person, looking at vitality, teaching them as a physician, teaching them how to deal with pain, giving them tools, and if it gets worse, here's what to do, and how to deal with the psychological aspects that are going to come up with your patients. And then the healing power of nature. So as we know, it's not just the nature of the person, but it is their individual constitution, their prakriti, we're stimulating their nature to heal, because the body knows how to heal. So let's talk about treatment. And really quickly, I know that modern day research is important, and we will discuss it, and you have my slides, and there are resources, and most texts are full texts, and I encourage you to, dive in deep. There's actually a lot of great research on the herbs I'm going to present. But I do want to bring up this ancient wisdom that Ayurveda uses, and not just since we've known it as a modality of medicine and a philosophy, but really the wisdom of the plants. And so I want to read you guys this quote, because I love the power of plants and really respecting and honoring their wisdom and what they bring to us as a gift. So plants bring us love, the nourishing power of the sun, which is the same energy of the stars of all light. These cosmic energies emanated by plants thus nourish, sustain, make, and grow our own astral body. In this way, the existence of plants is a great offering, a sacrifice. They offer us not only their own nutritive value, but the very light and love from the stars, from the cosmos whose messengers they are. They bring us the universal light so that we can enter the universal life. They exist for psychological as well as physical nourishment. The Sanskrit word for healing plant, which is osadi, means literally a receptacle or mind in which there is burning transformation. And that's from Dr. Vasant Lad, who really kind of brought Ayurvedic medicine over to the United States, and David Frawley. So tried and true, we're going to talk about turmeric. I want to bring up some new ideas around turmeric, and we'll discuss some research, but you all know turmeric. And there's many names for turmeric, and as you can see, it has been used in Ayurvedic medicine, and it's been used in India, and in all over the world for thousands of years. It's in the ancient texts, so much that in Sanskrit, that sometimes they just call it the yellow one, and everyone knows what they're talking about. And I love that it's also called Golden Goddess. And this picture right here is of a bride-to-be, and so it's called a haldi ceremony. And in Hindi, haldi means yellow, and so, in India, weddings are multiple days, but they have a haldi ceremony for the bride and groom separately with their friends and family, and they get pasted in yellow turmeric, and it's detoxifying, and it's very auspicious, supposed to bring them a good life of prosperity, and it's a cleansing ritual. And then if you are a single person that's at the wedding and you get pasted with the turmeric, you're supposed to find a good-looking match very soon. So I love this picture. She looks so blissful. And so as we know, turmeric is curcuma longa, and we use the rhizome and the leaf. It can be used for so many different things clinically. How many of you are just using turmeric in your clinics on a daily basis, regular basis? A lot of you. Yeah, so it's great. And food is medicine, so we like to figure out how to incorporate it into food. And so that's just the constituents, and you can read that. So this was a study I found, not a huge study, but it was 45 patients with active RA. There was 3 different groups. So curcumin group, an NSAID group, so diclofenac sodium, or they were taking both. And they were all doing 500 milligrams BID. Well, I think let's see. They were looking at disease activity score and then swelling and tenderness of joints with the American College of Rheumatology criteria. The patients were not allowed to be on any other NSAIDs, no steroids within 4 weeks of the study, and then no DMARDs or anti-TNF medication as well. And all groups showed significant improvement. That's right, the diclofenac sodium was 50 milligrams. I was thinking that would be a lot. So all of the groups showed a decrease, which we would expect. But the curcumin group actually showed a greatest decrease in both scores. And it was significantly more than just taking the NSAID group, or the diclofenac sodium. And then the biggest thing with this article, which was why I was excited about it, was that we know curcumin and turmeric are safe. And so when we're thinking about first do no harm, how can we help our patients that are in an acute flare and not do harm? And so the energetic properties of turmeric, I just want to share with you. It's tridoshic, so that's the great thing. You don't have to worry about pushing anyone into more imbalance when it comes to the doshas. Its properties are here. How many of you guys have tried golden milk? I mean, it's kind of hip right now, yeah. So it's great. I mean, I think any way we can get the herbs into our system and be able to encourage our patients to incorporate it into their daily lives is awesome. So there's lots of recipes online, of course. But we know about curcumin, and there's a lot of hype about the percentage of curcuminoids in a lot of the products on the market, and how much curcumin are you getting, and if you isolate it, it can be very expensive. And so I want to talk to you about the tumerones of turmeric. And so these are our lipophilic compounds found in turmeric. And so oftentimes with turmeric, you're putting it into milk, or you're using ghee, and you're using some sort of lipid or some sort of fat to be able to help optimize the absorption of curcumin. And so this was looking at, it was actually a study on cancer cells in the human intestinal tract. I'm not going to get into the cancer properties today, but what they found was that in the presence of tumerones, there was more curcumin that was transported across the epithelial membranes. There was an increased amount found inside of the intestinal cells, and then the amount of time that the curcumin was present, so the ability for it to have a therapeutic potential longer, was present in this study. And so I just want to, I think it's going to be coming up more and more. You know, we're already looking at how to increase absorption, so people are adding, drivers, or, ginger or pepper or that sort of thing, or they're attaching lipids to it. But if you take the DNA of the same plant, and you take the lipophilic compounds of it, you're really utilizing from the wisdom of the plant to be able to allow us to absorb more curcumin. And then who knows, there's so much more to these plants. Maybe there's more that's going to help us metabolize it and excrete it. And so I feel like we're going to be learning more about tumerones, and I also feel like as a full spectrum plant, we're going to start seeing that used more and more in medicine. I'm going to take a leap, but I'm in Oregon, so I kind of feel like this is the same idea as cannabis, where we're learning more and more about how the CBD and the THC are potentiating each other, and this whole orchestra that's happening within the plant. And cannabis was, and I'm not talking about it here, but used very much so in the ancient Ayurvedic, approaches to pain and other things. But, that aspect of using the full spectrum and the benefits, I think we're going to be hearing more and more about. So this is a little graph that shows the difference between a holistic turmeric extract, an extract that, or a 95% curcuminoid prep, and then a standard curcumin. So there's about 300% better bioavailability of curcumin with the holistic turmeric extract. The absorption rate is faster as well, so you get a quicker into the body, and so it can start working and helping people with their pain. And then the retention is also longer. And so, something to think about with your patients and the different things that you're using with them. So I want to talk about next Guducci, or Tenaspora cordifolia. Are you guys familiar with Guducci? Anybody? A little bit? Okay, cool. I was hoping I could bring some new herbs to you today. So this is known as heart-leaved moonseed, or Amrita, and it's considered to be one of the 3 Amrit plants. So the Sanskrit term Amrit literally means nectar, and so, or ambrosia, and it's in the context of Ayurvedic medicine. It is kind of the nectar of the gods, and there's actually 3 plants total. So Tenaspora cordifolia being one of them, and then garlic and haritaki, which is oftentimes in our, well, it's one of the fruits in our triphala, so haritaki. The thing about Guducci is it's really safe. So I searched and checked all my texts, and I could not find anything where it talked about it being, contraindicated or drug-drug interactions, and very well tolerated. We don't recommend anything really with due to limited research on pregnancy and lactation. So Guducci, so good. So a lot of the studies I did find were on how Tenaspora cordifolia could help with acute pain and inflammation. And so oftentimes those studies are done with animals, and it's, I didn't want to paste all of the titles because, they're creating acute injury and inflammation, edema in their paws and that sort of thing. But what I found was that it's really helping to decrease inflammation and then the perception of pain. So are you guys reading more and more about the catechol methyltransferase gene and how it affects our perception of pain? Have you been hearing about that at all? So, why is pain, we have this scale, right? And we have 2 people who are kind of experiencing on a physiologic level the same thing, but one is experiencing a 9 out of 10 pain, and one is experiencing a 4 out of 10 pain. And why is that? And so they're linking it more and more to the different genes that we have, and maybe mutations of breaking down catecholamines in the body. And so it was kind of looking at blocking this and then therefore decreasing the perception of pain. And it was helping with prostaglandins, so kind of decreasing acute inflammation, and was known to, or was found to possess analgesic activity, which involved the central, so the opioid receptors, as well as peripheral, so the inhibition of acute inflammation or the prostaglandin synthesis. And I love this picture. It's like the plant is dancing. So Guducci is bitter, astringent, it's light, and a lot of traditional texts talk about using it for fever, jaundice, and helpful with the immune system and that sort of thing. It's also, once again, balancing for all of the doshas, so you don't have to worry about aggravating any of those elements. And it's very sweet, so I like that. Okay, its post-digestive effect is sweet. So we know ginger, and it's anti-inflammatory, antiviral. We use it a lot for nausea. How many of you think about ginger when you're thinking about pain? A lot of people, great. So I like to think of ginger, especially different times of the year. So this time of year when people say, you know, my pain gets a lot worse when it's cold out, you know, and I live in the mountains and it's very cold and we get snow and it's very dry. And so anything you can do to increase that circulation and kind of calm vata is important when it comes to pain that gets worse with cold. Of course, contraindicated with blood thinners and aspirin. So this was a review study, and basically they were looking at rheumatoid arthritis, osteoarthritis, and then just muscular discomfort. And it was kind of this review of, well, what happens between taking ginger anywhere from 3 months to 2.5 years. And they found that it was very helpful in those conditions, and also that they recognized the pain-reducing effect via an inhibition of prostaglandin and leukotriene biosynthesis. And there was another study that, or review on ginger, more or less for looking at the specific prostaglandins it was affecting, and it actually was shown to increase glutathione level and antioxidant enzymes. And so if we're thinking about acute inflammation too and what's happening in the body, how can we help the body clear out anything that's creating a continual cycle of inflammation? And it was, one study showed that ginger was more effective than indomethacin in reducing the pain associated with inflammation and oxidative stress, but pain that can come with heavy exercise and that sort of thing, you know, basically anytime you're gonna create somewhat of a degeneration in the body, that is gonna be affecting our vata, and vata is cold, and so you want to have the increase of circulation and that sort of thing. And then this study I found was using ginger with pelvic pain, and the women in the study, well, there was 7 studies, but 4 of them met the criteria, and then they were looking at if women that were having primary dysmenorrhea incorporated ginger within just the first 3 to 4 days of their menstrual cycle, and they found it to be very effective, and they were mostly using the visual analog scale for recording the benefits of ginger during that time. So boswellia, you might be familiar with this, you might be using it already. It is a beautiful resin, and it's golden, and you know, was given to newborn Jesus. It's in a lot of ancient texts of this, all the different healing properties it has, anti-inflammatory, analgesic, and mostly immunomodulating, which can be very helpful. And the main concern with side effects is just a little bit of GI upset, and then I like to think of the doctrine of signatures with boswellia, so I kind of feel bad for this ant, but you can see how sticky it is and that dense sort of sticky quality, and what that might how it might affect our bodies. And so this the study on the bottom was a small study, but I really liked that they were dealing with osteoarthritis and looking at they were doing x-rays and basically seeing what changed over utilizing boswellia in the study, and they found that it decreased osteophytes and it increased that joint gap. So it was helping with the cartilage itself, and so they found that it reduced the enzymatic degradation of the cartilage in the OA patients, and also reduction in HSCRP, which I never thought about being an indication of osteoarthritis. I was always thinking it was more cardiac, but there was a study that came out that talked a lot about by checking the HSCRP, it was able to tell them how far of a disease process of OA the patient had. And so have you guys heard that being used? I'll find the study because it's not on my resources, but I will, if anyone's interested, I'm happy to share that with you guys. And then rheumatoid arthritis as well. So this was sort of looking at joint swelling, ESR, so inflammation, stiffness, any additional use of NSAIDs, side effects, and once again, tolerance, and found to be very helpful in compared to complete placebo for rheumatoid arthritis as well. So ashwagandha, and we know that it is an adaptogen, and it's oftentimes used just to help people deal with stress. But this herb in particular can be very helpful, especially if you have patients who maybe they have anxiety with their pain, or they're really kind of freaking out about being in pain, or they're in chronic pain and their nervous system is just exhausted from dealing with pain all the time. Ashwagandha can be very helpful for that. So ashva means horse and gandha means smell. So it's supposed to give you horse-like stamina. It's known as winter cherry. I got to see it growing in the wintertime in northern India. It was beautiful. Being a cherry, there can be some cross reactions with anyone that has nightshade family issues, so just be aware of that. It's known as a rasayana, so we call anything that's a rejuvenative tonic that can be used with all the doshas to kind of help build ojas, or that vitality and immunity in a person. We call that a rasayana. The research is really great on ashwagandha. So one study I found that was, just listed all the different properties and had anti-inflammatory and anti-arthritic on there was great, but all the other things it does. It decreases circulating cortisol, increases DHEAS, and those chronic cardiac markers can be very helpful for decreasing CRP, and we'll get back to pain, but I love ashwagandha. So this was a study on knee pain, and it wasn't really specific as far as it being osteoarthritis or any sort of tears or anything, but it was knee pain that had swelling, and they were using ashwagandha to decrease that knee joint pain. And so there were 60 patients, and they were looking at dosage here and safety, but they were looking at 250 milligrams versus 125 milligrams and seeing if there was a big difference in the decrease in pain. And so they were looking at the modified Womack rating scale and knee swelling index, and then also using the visual analog scale too. And so within 4 weeks, the group that was taking 250 had a greater improvement right off the bat than the 125 group. So dosage being important for that. At the end of 12 weeks, there were decrease in both groups, but the individuals that were taking 250 had a much greater increase in their pain. So I want to talk about some fun ways of incorporating Ayurvedic herbs into your patients' treatment plans and into your practice, because a lot of these herbs you're familiar with and you're already using, but maybe incorporating them in a patient's treatment plan in a different way, or if your patients are just taking so many capsules, how can we really help them to be able to get the medicine in either in their food or maybe a different way? So are any of you familiar with the word anupan? It's a delivery system, a method in Ayurvedic medicine to get the medicine in. And so we think about using different anupans for different constitutional types. And basically you would take a substance and you would mix your herbs into it. I mean, water can be an anupan, or warm water. But if you are working with someone and you have an idea of, they're always cold and they're anxious and they have insomnia, and you start to get more familiar from Ayurvedic medicine, maybe you're thinking, okay, I need to help treat vata in the body, that air and wind quality, because it's moving everywhere and it's having a hard time grounding. So warming beverages are really good. So you could just use warm water, but even better, Ayurveda would say to use warm milk. If they can't handle milk, then you can do an alternative, but some milk alternatives are more aggravating, in particular to vata. So coconut is cooling, so we don't really want to use coconut. Soy can create more gas. So you might want to think of like a sort of dense warming cashew milk or almond milk or some sort of nut milk that has protein. But they can mix their herbs right into it. Think of the golden milk example. That's like the perfect vata treating drink, especially in the wintertime. For pitta, because there's lots of fire and inflammation in the body, as you know, for GI stuff, we often use aloe gel to really heal and soothe, and we even use it in the urinary tract and that sort of thing. But you can take aloe gel if someone's really inflamed and have them mix their herbs into that and take their herbs, and so you get that sort of double effect of cooling and medicinal and soothing for the GI. And we would actually end up using either warm water for kapha, or you can do honey, which might be counterintuitive because honey is sweet, but it's actually considered kind of a cleansing of anything that's stagnant. So it's scraping anything that is kind of stuck in the body in kapha. And so, I mean, if you're adding of herbs, like I love Chinese medicine and their powdered herbs, but sometimes things like that are hard to get down. So if you add it to honey, it's like a spoonful of sugar helps the medicine go down. It's really quite nice. And then food, like I mentioned, so incorporating the different herbs into your food. I had some people come by the booth yesterday and they wanted to have some ashwagandha in their coffee after Jason had mentioned putting ashwagandha in the coffee and kind of how they mirror each other. So of course we can do capsules, but topically also it can be really helpful to incorporate these different herbs. I mean, even ashwagandha topically, there can be benefit. Ginger topically, we can see a decrease in pain, increase in movement, and as you know, our skin is the largest organ, and so absorbing those herbs can happen with the right delivery method. And then injectables and IVs, some of these herbs are actually available in IV and injectables. And then, as we talked about yesterday a little bit, inhaling the herbs or bypassing the GI and kind of getting into the system can be helpful and has been used in Ayurvedic medicine for thousands of years. These are two treatments I want to share with you because you might not be set up to do this in your office, but they can be very helpful for pain, and you could always, you know, have an Ayurvedic practitioner come to your office or send your patients to one, or get creative and think about how you can have them utilize the idea of these at home. The Shirodhara is a continual stream of warm oil over the third eye. And it is really helpful for pain. It calms the entire nervous system. It is great for headaches. It's great for anxiety. It's great for insomnia. And when I had my first treatment of Shirodhara, I could not drive home because it really puts you into another space, and it calms your nervous system down so much. So just be aware if you ever go get a treatment. Have any of you had a Shirodhara treatment before? A couple of you? Okay, yeah, it's a powerful treatment. So it can be helpful in the regard of treating the nervous system for pain. And then Basti. Basti can be done anywhere on the body. So you can create it's a dough dam. And there's other things out there you can use, like they created plastic ones, and it's innovative now. But you can do it anywhere on the body, and the idea is that you're creating a concentrated treatment with herbal infused oil, and you continue it to add warm herbal infused oil to this area. And when we were shadowing at the hospital in northern India, it was a government-run hospital, and we got to see the charts of the patients and actually perform the treatment on the low back for an individual there. And you want to have pretty regular treatments if there's pain to try to help disperse it and treat it directly. But he was getting better. His pain scale had gone down since starting the Kati Basti. So this is an oil that's used in Ayurvedic medicine, Maharayan oil, and I call it grandmother's secret. It's an oil used for arthritis of any kind. It's made with 20 to 35 different herbs, so the recipe is going to kind of change depending on what company and different things. But in general, the qualities are that it's warming and it's nourishing, and it's actually helpful for all the doshas if they're stuck in the tissue. And it's best if you can use it warm. And I wanted to pass around this oil so you guys can smell it. You can try it. It is very. It has a very potent smell. So, if you don't want to put it on your body, that's fine. But it's this beautiful red color, and can be used when there's pain in general anywhere in the body. So other ways to address pain, we know that there's things people can do with their lifestyle. There's diet, so many different diet types, but we won't get into that. But Ayurvedic diet, we usually try to, depending on the person, have them cut out things that are going to increase qualities of those doshas. And then herbs that I mentioned in the presentation, and cannabis, as I said, has been used in Ayurvedic medicine for a long time. Of course, naturopathic medicine, some of the Ayurvedic treatments we just talked about, neural manipulation, working with the nervous system directly, all of our manual therapies, and somatic medicine, and bringing things in that can help people deal with the psychological effects of their pain. Injections, of course, detoxification, chiropractic, acupuncture. You guys know we're great with integrative medicine. Did anyone see this National Geographic that came out this month? No? It's actually really amazing. It's all about pain. So I thought, this is perfect. I wanted to kind of see what else is going on out there. We're talking about ancient philosophies and treatments, but they can be used in this modern day just as well, and the research is there, but what else is going on? And so if you have a chance, pick it up and check it out if you're at the grocery store or whatever. They're using a lot of virtual reality to help with pain. So it's a distraction method. And at UW, they're actually doing a study where an individual broke his pelvis in two places, was being held together by pens. They did one surgery with, regular anesthesia and his pain scale. And then the other side, he was awake, but he was doing virtual reality at the same time they were doing the surgery. I'm sure they had some local stuff going on, but the recovery time was faster when he was under less, general anesthesia, and then he felt less pain in that area. So if we think about it, right, our nervous system and our brain is just doing the best job it can to keep us safe, and there is a certain truth to when you are focusing, how does that sort of ingrain those pathways more deeply? And they're doing the genetic piece that I was talking about earlier, they're looking also at genetics of, like, there's a woman who can't feel pain at all. And so really trying to study what factors on a genetic level are setting us up for perceiving pain and how we're able to deal with it or not deal with it. And so they're looking at using scorpion venom to create new pain meds too. So really trying to help figure out ways to deal with the opioid epidemic that we're in. Some case studies I want to share with you. So I had a patient who came to me and she had all of her major joints replaced. She had both hips, both knees, but her right knee, she came to me, had been 3 years since the last surgery. The other ones were fine, but this knee, there was persistent swelling, and there was persistent pain. And so first thing I wanted to rule out was, well, what made that one different if your body did well with the other ones? And so we looked at the hardware to make sure there wasn't anything that her body was reacting to. But it was the same as the other ones. And the surgeon, it was a little unclear, but he said he may have harmed a cutaneous nerve. That was maybe what was going on. But, you know, within that 3-year period of me seeing her, they had done steroid injections. They had, put her on hydrocodone, and she had been using marijuana, but because of her job, she didn't want to be on anything that would show up negatively in her job screenings and that sort of thing. And so you can read that there, but she had gained weight since she was unable to exercise, and we went through her diet. It was pretty standard American, but she also was really into peanut butter. She was snacking on it and just really, really into peanut butter. So her treatment plan really was putting her on an anti-degenerative, anti-arthritic, anti-inflammatory diet. And then I asked her if she'd be willing to just substitute the peanut butter for almond butter, as it's usually less inflammatory and a little bit better for her constitution. Hydrotherapy, on the knee, it'd be great if I could get her to submerge and go back and forth between hot and cold, but I just said at the end of your hot shower, use the cold and follow the lymph channels and just try to create some focused energy on that area. Swimming was something I recommended to just get movement in. And then all of the herbs that were in the webinar in a formula, plus Gokshura or Tribulus terrestris, which can be helpful for neuropathic pain. And we did a warm oil treatment at night and wrapped it in had her wrap it with a cloth she didn't care about. So we followed up within 3 weeks, but she actually wrote me an email because she was really excited that the herbs had decreased the pain and swelling significantly within 1 week. And she was able to walk more, which was really important to her. She had some family stuff going on, and she was able to do that without being in extreme pain. Within 3 months, it was mostly just dull, achy pain, but the pain scale was down a lot. She did decrease the formula to half of its dose, but she was able to sustain that improvement. And she had lost 25 pounds within the 3-month follow-up, which she was walking more, she was doing her swimming. And then we had a 6-month follow-up, and I reached out to her before this conference. She only lives in New Mexico part of the year, so she's gone, but I tried to reach out to get an even more recent update. So I don't know yet, but how she's doing, because she was going to try to eliminate the formula and see if her body was still happy without the formula, and because the swelling has gone down, because she's not in as much pain. And I like to do that with patients. I don't want them to feel dependent on something forever. I want their bodies to get what it needs and then get on with life and not have to be dependent. But sometimes people need things, obviously, long term. So she was continuing pretty much everything. Her weight loss had slowed a little bit, but we had holidays and that sort of thing. So really the pain was only present if she was sitting too long. And then she would get up and move around, and eventually it would kind of dissipate. So this is another patient of mine he's in chronic pain. I've been treating him, it's been longer than 3 years, but he has a congenital fusion of a C1, C2, so they work together. And I don't know if it was because of that or if other things were playing a role, but he had 2 neck surgeries. One, they went in the front of his throat, and then the second one was in the back. And so they were kind of dealing with bone spurs and trying to free up more space for the nerves. But anyways, he has his daily chronic pain, and then he has what he calls zingers when he's trying to open up jars or anytime there's pressure, or he's kind of activating that side. He uses a lot of different things, but he gets chiropractic, he does meditation, he uses cannabis. But it's a constant battle of the mind, and so when he came to me, it was what can we do? Because he had been on opioids for a long time and had weaned himself off, and he had experimented with kratom, which is definitely still in that same category. So what we did was, we're doing body work and trying to help release and support the body and the nervous system. And we always use oil. But I put him on a high potency boswellia and curcumin. And what he noticed, because he'll do trials of taking himself off, and then he'll notice that pain threshold it's up 1 to 2 points if he's not on those things. And so he does use topical CBD. And he told me I could use this quote, which was, I can either keep living my life to the best of my ability with chronic pain and try to relish the moments of joy, or give up, and that some days are easier than others. And he's sort of on a journey to figure out what living with pain means to him. And we talk a lot about it, and he says, it keeps me present in the moment. He also, is really trying to figure out the spiritual meaning and lessons, and he's just really on that path. So I just encourage him, whatever that means to him. But an interesting development that happened recently, he actually had acute cholecystitis and had to have surgery, and noticed after that his pain in this area did decrease, like maybe just a 0.5 to 1 on the scale. And so we were looking it up and just being curious, because the gallbladder meridian runs right there. And I don't do Chinese medicine, but I'm fascinated and wonder if kind of there could have been some messages or reciprocation happening with that area of his body, and his gallbladder was obviously suffering. So we'll kind of monitor that as we go on. Okay, so I want to switch gears, and I go till 10, right? Yeah. Okay. So I want to teach you guys we're going to talk about the brain next, and herbs that can help with pediatric ADHD. But I want to teach you a breathing exercise.
We have a couple online questions before we move to the next section, possibly.
Oh,
Can you
okay,
answer those?
sure,
Okay.
yeah.
You can check sound because I got this wired up. Wait, oh, hey, it's gonna turn it on. Okay, now you can all hear me. So we have a couple questions from the online audience. Thanks. That's the tech one. Let's go back. When you say holistic extract, was that an alcohol tincture extract?
So holistic extract is actually where I don't know how much, it's sponsored by Rebel Herbs, so I think I can mention it. Basically, they're doing a CO2 extraction to pull out all the lipophilic compounds of a plant, and then taking that same plant material and doing a water and alcohol extraction to pull out all the hydrophilic compounds, and then they put them back together. So you're actually getting the full spectrum, the holistic extract of the plant, just minus the plant fiber and starch. So it becomes really potent, but you're getting that whole medicinal profile, all the constituents in the plant.
Okay, and then can you speak to the safety profile of turmeric and guduchi in children?
Yes, so guduchi, really, really safe. Like I said, I searched for any sort of contraindications, and so, that one I really couldn't find anything on. And turmeric, I would say, you're going to be using less. In general, it's safe. We just want to think about if patients are on blood thinners, it can help statins work better, so you're not going to be really seeing that with children. And, having them incorporate it in any way you can. So if you can get it into the food, I would recommend that. And using a holistic extract in food allows your food to be truly a medicinal and therapeutic dosage. But just watch out for, issues with the tummy or something. I think that would be the biggest thing I would think about. So,
Great, thank you.
Yeah, no problem. Okay, so I want to teach you a breath before we get into the brain slides. I want you to find a comfortable position and put your feet on the ground, and if you can, push your computer aside because it's a good distractor, you know? So this is Nadi Shodhana, which is an alternate nostril breathing. You maybe have done this before in yoga classes or meditations, but why it's important is it balances the nervous system and it balances the right and left hemispheres of the brain. And so I use my right hand, my right thumb and my ring finger, and I'll place my other two fingers on my forehead, just really resting it there. And you can do it whatever is convenient for you. So if you just want to use, you know, any finger, but this is sort of the preferred position. And I'm going to show you a little thing before we get started. So I like to think of a mountain because I'll show you and then we'll do some breaths together. Basically, you block off the right side, you breathe in through the left, and then you switch to breathe out the right. But then you stay there to breathe back up. And then you switch to breathe out. And then you stay there to breathe back up. So you're climbing the mountain with the inhale, and you're switching at the top to go down. But then you have to stay there so you can go back up. So let's do a few breaths together, and close your eyes if you feel comfortable, and go ahead, and if you get confused, you can look at the slide. And keep breathing, and as you might notice, the breath will deepen. And if you're congested, do your best. Try to breathe in on either side. It can actually help decrease congestion. And do another round, so one more time on each side, wherever you're at. So Nadi Shodhana, it opens up the nadis, which there's 72,000 energy channels in the body. It's one of my favorite breaths to teach patients when they're feeling anxious or they have a hard time focusing. They wake up in the middle of the night. It can be really, really potent to help just calm the nervous system and the right and left hemispheres of the brain. I think of it as an adaptogenic breath. So if you're feeling sluggish and tired, it will help you focus. If you're feeling anxious, it'll help you calm down. And so with that, we'll talk about the brain and ADHD. And so this is geared a little bit more towards pediatric in particular, but obviously can be translated to adult ADHD. And so I'm going to cruise through these. You guys know the definition of ADHD. Most importantly, there's the three types: inattentive, hyperactive / impulsive, and then mixed, which has the signs and symptoms of both. And so, of course, there's no lab test to diagnose or imaging. You want to make sure that you're ruling out challenges with hearing, visual, and it's usually gathered through, reports from parents and teachers and that sort of thing. Of course, there's a checklist from the DSM-5, which can be helpful, and I put that in here. This is for inattention type, and you can kind of see the different symptoms that the children might be experiencing, and you need 6 or more in children. And then the hyperactive or impulsive type, also 6 or more symptoms, and you can kind of see it brings in the impulsivity and movement and having a hard time kind of staying in your seat. So in addition to that, the criteria must be met where the symptoms are present in more than one setting, so at home and at school, and that it interferes with their quality of work, schoolwork, social, that sort of thing, and it can't be explained by any other mental disorder. So Western treatment, you all are familiar with using stimulants for ADHD, and that is sometimes counterintuitive, but amphetamine and methylphenidate are actually calming to individuals with ADHD, and they kind of increase dopamine, which leads to increased motivation and attention. So you can think of someone with Parkinson's that has not enough dopamine and they're having a tremor, and so if you give them something that increases it, it will help with that impulsivity and ability to stay in focus. And there's a lot in parent training and behavior management and classroom things that can be done. Other non-stimulating drugs, Strattera, which is atomoxetine, and a few other ones that are used. So treatment in particular, when we're thinking about herbal treatment for pediatric ADHD, we can think about some of the same herbs we would be considering for brain function in the elderly and just improving cognition in general. So our Bacopa, we know is helpful. It's nootropic for the brain. The active constituents are here. We look for bacosides A and B, the steroidal saponins, and the kind of actions of it is increasing blood flow, so it is helpful in that regard, neuroprotective due to antioxidants for the older population, but also just if you're, any antioxidant activity can be helpful if you're having, just living in the world that we live in today. We can use all the help we can get with that. Being an adaptogen for the brain, there is acetylcholinesterase inhibition and our choline acetyltransferase activation, so more acetylcholine available for neurotransmission. And then we see it increases GABA, so that can be very helpful, and helpful with dopamine, so thinking about that piece of the impulsivity. Bacopa is going to be helpful not just for the mental aspect, but for calming the nervous system and decreasing that aspect of ADHD, the hyperactive form of ADHD. So there's some studies on pediatric ADHD. There was a systematic review I found where 9 studies focused on ADHD, and out of those, 5 show statistical improvement in behavioral outcomes, and mostly in visual perception, but the impulsivity piece and attention was helped. And then the safety and tolerability was only reviewed in 44% of those studies. There can be some GI upset, and but I think of it as like the breath, what we just did. If you're needing help with focusing and you're feeling sluggish or brain fog, it can increase your ability to do that. And if you're kind of all over the place, it will help to kind of calm down so that you can focus in the nervous system. And then there was an open label study, so 31 children ages 6 to 12, and the restlessness reduced in 93% of them. The attention deficit improved in 85. There was no improvement in the social scores, but it was well tolerated, so no GI upset for that one. And then looking more specifically at what would the side effects be, or what tolerability might we be considering, in 2.3% of the participants in a review of 5 studies, there was some GI upset, but it did improve the hyperactivity piece and attention deficit improvements, mostly verbal and visual memory in improvements. And then there were smaller studies, so of course more research always helps in our field. This herb I'm really excited to share with you. I've talked with a few of you already about it. We don't learn this in our naturopathic training, and I love this this tree because it's called the tree of intellect. It's also called Joy-Tish Mahdi, and Joy-Tish is bringing light to the mind, and so Mahdi is mind. And so, you know, thinking about the gift of the plants and how they're helping bring light from the cosmos, as that quote was stating in the beginning, I really like this one. And so it's known as black oil plant as well. And this, I brought some so you guys could try it if you want to. It does not smell like the other thing that I was passing around. So you can see the color of it. Basically, they're taking the seeds and they're pressing them and they're getting the oil out of it. And so you want to, a dose is 5 to 15 drops for adults. And I have a slide on this, but 1 to 5 for children. And so if you want to try it, I encourage you to take some and then just notice, but just be curious if you feel any opening in the mind. People would take this before meditating, and it is used in as a cholinergic in brain formulas and that sort of thing. And we'll talk more about that piece, but maybe. So of course we know that the brain loves healthy fats. So there are palmitic, stearic, oleic, linolenic, and linoleic acids in Solastris paniculatus. 52% oil by weight. So these are the energetic properties, and it can create GI upset if you have more than 2 grams of the seeds. So one thing they'll do, and I'm gonna have them pass around this too, I brought the seeds for you guys to see. Some people will grind up the seeds and use that as a powder. That can be kind of hard on the GI. The other thing is that they press the seeds and then they get the oil out of it and they use it that way as well. And so contraindicated if you have any GI ulcers, if you're pregnant, trying to conceive, or lactation. So they can see the seeds. So in pediatric ADHD, you know, there's different ways of taking this oil in, but in some of the ancient texts, if you do warm milk at night for the children and you do 3 to 5 drops of this oil, then you'll see improvement in concentration and memory within 30 days. So, you know, you might not notice something taking it right now. You probably would have to take it for a while, but for those of you that are really sensitive to the energetics of plants, you might notice. And be able to tune into that. So this is some research. This is really about memory and helping to enhance memory. And so oftentimes, once again, when we want to see quick effects for memory or for, like I mentioned earlier, acute inflammation, we're using animals to create amnesia and then see what happens when we give them this antioxidant protective nootropic oil to see if it helps their memory. And so the study one was a water maze, but they found that there was statistical significant memory improvement compared to the control, which was a memory enhancing drug. I don't know if you're familiar. I don't think it's available in the United States, but it's paracetam. And then the other study, they looked at how they were doing with different tasks and tests and how their memory was after the amnesia, but they were also checking neurotransmitter levels. So there was a decrease in norepinephrine and 5-HT in the brain, and their metabolites they looked at within the urine as well. And so overall, they were looking at the central monoamines and how that was involved with memory and concentration in the processes that they were testing the animals. This was a study I found on Solastris paniculatus versus monosodium glutamate in human neuroblastoma cells. So, of course, we're thinking about a lot of other things with ADHD and children, and are they getting preservatives? Are they getting MSG? What what other factors could be playing a role, food dyes, and we'll talk about all of that. But this was interesting because they created neurotoxicity in the cells with MSG, and then they gave Celastrus paniculatus oil to counterbalance that, and because of the antioxidants, they found it to be very helpful. It increased the activity of superoxide dismutase and catalase, increased glutathione and glutathione peroxidase and S-transferase and the reductase enzyme. So it was kind of helping that regeneration cycle of glutathione to counterbalance the toxicity that had been created by MSG. And then this study was on a herbal formula, which is flax, bacopa, Celastrus paniculatus, ginger, and rosemary. Some of you might have tried it yesterday, and I encourage you to bite into the capsule and your tongues turn blue. But there is research on pediatric ADHD and this formula in particular. And so there was 2 phases. The first phase of the trial was 1 to 90 days. And that's where they were given either the formula or placebo. Thank you. And found improvement. They were using Dupal's ADHD rating score and evaluated every 15 days. So the placebo was sesame oil, and there was slight improvement in the placebo, which I find interesting because if we think about children that are having ADHD, sometimes just having the continual support and check-ins and really, being present and letting them know that we're trying to help and work on it, I find that it's interesting but not surprising that the placebo would also have some improvement. It didn't have as much as the herbal formula, but I think when we're looking at pediatric ADHD and how we can help with working with the parents and the teachers and creating a supportive environment. We have a book, ADHD is Not a 4-Letter Word, by Karen Ryan. I highly recommend that. She's coming out with a new version, but really great strategies for parents and creating consistency being very, very important. The phase 2 of this trial, those that responded in the first phase would continue on. In Ayurvedic medicine, if someone doesn't respond, and this is how I am with my patients too, if they're not responding, a little bit within 6 weeks, but 3 months is kind of the top, then I did something wrong. I wasn't looking at the right nuances, or there's something missing in their treatment plan. So they had those individuals discontinue. And then they continued on with either the same dose or a higher dose to see if the dosage mattered. And what I really like about that part of the study is it showed that the low dose was just as effective as the high dose. And the benefits from taking the herbs continued even after they stopped. So that's the ideal, right? If we're giving children, and I'm not against the Western options, but if we're giving them something that they're going to have to continue on for the rest of their life, and the side effects are really challenging for them, if we can incorporate something that helps them and reprograms along with the support, maybe they don't need as much, or maybe they will need it for a long time, but they also could actually get the support they need and not have to continue taking it. And that's the kind of medicine we want, right? Do no harm. So other factors that affect the brain, as you all know, phosphatidylcholine and serine, our GABA and 5-HTP, our fish oils, our healthy fatty acids, and Ds and Bs. Other considerations, as mentioning earlier with the MSG, we want to make sure that we're not creating any neurotoxicity. Food dyes, unfortunately, most children's food is colorful and oftentimes has food dyes in it, which is not going to be helpful for them. And just sugar and caffeine and other preservatives. And then, in the adolescent pediatric category, we're thinking, is there any other drugs or alcohol, that sort of thing playing a role, and aspartame, and anything that's in those energy drinks that people are guzzling down can be really scary for what it's causing in the brain. I had a patient recently, actually a representative in New Mexico, and was having these extreme headaches and changes in vision and all of these different things happening on a neurological level, and went in and they were doing an MRI and they just could not figure out what was going on. And after going through, it was like she was on these energy drinks that had a bunch of preservatives, and basically looking through them, like, were very neurotoxic, and she called it brain buzzing, but she would like get this brain buzz and then her vision would change. And I kind of thought, like, could really like that be the case, but ever since she stopped them, she hasn't had any issues. So really, if you're thinking about a little one though, and how sensitive they are, even just to the environment that they're in, they're little sponges, and so how can we be consistent and create a supportive environment? These are some case studies. So I had a mother come to me in New Mexico, single mother, and her son was recently put on the drug Vyvanse, which is being used a lot for ADHD. And she was so scared because his whole demeanor had changed, and he's 11 and he was sneaking out at night to go walk, just needed to go walk. And then there was a lot of just kind of changes in his mental status, and talked about wanting to quit school and kind of conspiracy theory and different things. She was really scared, and he was having some religious delusions too. And so we went through, of course, all the diet and prescriptions and other things that might be going on. And we're talking low income, and diet's not great, and a lot of prepackaged foods, and the closest grocery store to where we live is a Family Dollar. So we're not in, we're in a food desert, and it's amazing to see the health challenges people have, and then realizing that obviously main connection. And so how can we help educate, especially when there's not a lot of income and time? That's a big thing, but you do what you can. And so being restricted previously in New Mexico, I'm not prescribing anything, and so I worked with the psychiatrist and kind of figured out if we could decrease, or do we need to wean off, and what can we do? And because of the extreme side effects, the mother, and she really wanted to have a plan in place, but was willing to try to utilize herbal medicine and some different counseling and different things to help this boy. And so we had him start the NeuroSteady formula, and besides some social stuff, which they had recently moved, and there was some challenges just adapting, I think, too, which probably exacerbated the symptoms. He's doing a lot better. He's playing basketball, so getting that sort of energy out, but the schoolwork itself has improved, and the attention and the ability to get through what he needs to get done, and no side effects. So we'll see what happens as we continue, and I'm grateful to have a team and have the psychiatrist who's willing and open to try other things. And I next want to talk about Scarlett. She's really sweet. So her parents were surprisingly very hip to all of the natural modalities and behavior, and they were like on it, and that makes a huge difference. If you have patients that can their parents have time to spend with their children and create those structures, these are two very different cases. She was actually familiar with the book ADHD is Not a Four-Letter Word, which kind of breaks down a lot of the things we know as naturopathic doctors, dietary wise, and other things you can do to encourage brain health. But she was on a kids multi and some fish oil gummies, and we started her on, so she didn't really have the hyperactivity piece. She's a little fidgety, but not diagnosed with the DSM-5. We started her on the bedtime beverage, which her mom, would make golden milk, or they would always get into sort of this routine together. It was really sweet. And then being creative with food. So we talked about using Gotu Kola or Bacopa or any of our centella, all of those herbs for the brain that are kind of green and fluffy, and you can make like an Indian saag with them, and it's really good actually, and you're getting sort of this brain meal. An Indian saag is usually spinach, and so you can just add it in there and make it with coconut milk or however you want to make it. But it's great. And then we found a focus formula that was a glycerite. She's not really into capsules, and maybe we'll work on that in the future. But the focus formula had bacopa, ginkgo, passion flower, and ginger. And then, she's in 3rd grade, so they're going to do their standardized testing this year, and we'll kind of see. But in general, she is getting her schoolwork done, and the teachers notice just an improvement in focus and ability to kind of do what she needs to do in class. And then I put a frog breathing exercise in sitting pose. I was going to show you guys, it might be a little hard, and I want to make sure I have time for questions. We're almost out of time. There's a frog pose, which is just like you're sitting, and it's a way to, calm the mind. But then there is also the frog breathing exercise. It's a Kundalini practice. You can Google it, but basically it's utilizing the breath, and it helps to balance the endocrine system, and it is strengthening, and basically Yogi Bhajan would give it to what he called like wild teenagers. But it can be really helpful for focusing the mind and kind of getting that energy flowing, but if there's excess, getting it out and helping. And so we taught her that, and she loves all the things that we have to offer. So these are the resources for pain. You have all the slides, and like I said, I tried to do most full text. If you need any of the other ones, like the Gene on pain article I found, it's not on here, I'm happy to share that with you. And then resources for ADHD for the different herbs and modalities. And do you guys have any questions for me? Do you want to share any clinical pearls or have a case study, anything that about pain or pediatric ADHD?
One.
Products or delivery of liquid bacopa for a kid?
So if I was thinking about just bacopa, I would probably trying to think if there's just a bacopa glycerite that might be available. Yeah, do any of you know if there's just a straight bacopa glycerite out there? No, maybe?
Herbal Vitality? Yeah, that's a good one to check out.
Okay, yeah, I'm familiar with that. They're in New Mexico too. Yeah. They were the only ones that had glycerite of golden seal the other day when I was trying to find it. So, okay, that might be good.
I have a question about curcumin and turmeric. So in school we learned that you need the black pepper to pair with it in order for absorption. Recently, I was told that black pepper is only there to actually open up like gap junctions within the intestines. And then that is kind of the way that it gets through, and therefore kind of causing leaky gut in some aspect. Can you speak on that, or is that still kind of the idea that we need that black pepper paired?
Yeah, so I would say the benefit about using a full spectrum turmeric is that you're getting the curcumin plus the tumerones, and those are the lipophilic compounds within the same plant, and those are what are gonna increase the absorption of the curcumin. People do use black pepper. I'm not sure about the gap junctions, but any sort of driver, black pepper or ginger, would be considered just kind of increasing the absorption. But the best we've seen is when there is a lipophilic compound present. So, people are adding oil, or traditionally you'd use ghee or milk, but the research on the absorption in the intestinal cells that's in the very beginning about the tumerones really shows that that's helping to increase bioavailability by 300%. So you wouldn't really need anything. You would just need the full spectrum of the plant to get the most absorption of curcumin. Yeah.
There's a lot of opinion on this, and I'm not sure all those opinions are based on facts. But there's at least a half a dozen, there's probably up to 8, methodologies to enhance the absorption. Some of those are high nanoparticle stuff, and there's, like I said, probably 6 to 8 methods. One of those is the black pepper. So you can read what you want to read and conclude what you want to conclude. But it's hard to argue with, generations of human beings who are using turmeric in traditional ways. I don't think they all acquired leaky gut syndrome. That'd be a whole population of India and wherever else.
Yeah.
Where do you get the Celastrus oil?
Well, I like to use the formula, of course, with Celastrus, bacopa, flax, ginger, and rosemary from Rebel Herbs. But I wanted to show you a pure Celastrus oil so you could kind of get familiar with that herb, because it is unique to our education. And so I just found a company that did a cold press of the Celastrus oil, and Debe, was it called? I'll look it up and let you know. Yeah, I just like being able to share them in a real way, because we get to do that in school and then things stick. So.
What's the delivery of the Rebel Herb product? Is it a capsule or is it?
Yeah, so it's a really tiny blue capsule that's only blue because it has blackcurrant and carob powder in it. And so for children that are able to swallow the capsule, that's what was used in the study. They try to syrup, but the rosemary is really intense, and it's, it doesn't taste the greatest, but I like the way it tastes. So, but that's sort of the delivery method for that product in particular. But like I said, I like to get creative, and if, you can do the oil or you can incorporate it in food more, but you're using, not just turmeric off the shelf, but if you're actually using that holistic extract we spoke about, that allows your food to be, a therapeutic dose of that herb. And so we can talk more about that, but you don't want to cook it in there. You want to wait until the food is cooked and then add it afterwards. So. Any other questions? Thank you for having me. It was so great to talk about.
Hey, Juliette, thank you so much. That was excellent.